And we've got an interview you'll want to stick around for. An eye screening device that could prevent blindness may one day detect heart disease. We'll show you how it works a little bit later. Really happy to have Dr. Sunil Gupta here. It is Diabetes Awareness Month, and in between us is a scary-looking machine. But what is this thing? What is it, and what does it do?
It's actually a camera that takes an image of the back of the eye, the retina, which is where diabetes damage occurs mostly. And so it's a completely automated system where pretty much we can train most lay people to be able to use this instrument to capture a picture of the back of the eye.
And so I'm going to put my chin here, my forehead here, and you're going to go ahead and start this process, right? What do I do?
Just like that. Just look straight ahead, please.
Okay.
We're just going to go ahead and put your chin down a little bit more. Good. Perfect. And this system is completely automated. It's going to actually find the right and left eyes. It's going to center in on your pupil, focus in on your retina, and capture a photograph that's then exported to the web. And we actually process the image, analyze it, and then send a report back either to the primary care doctor, the community clinic, and even give a patient the copy of it to look at. But basically what we're trying to see is, do you have damage from diabetes in your retina or not? And the goal is to catch it early so we can do something about it.
I'll tell you what, let's take a break. When we come back, we'll see what my tests are. I don't know if I want to know this. We'll test it out. All right, stay with us. We'll be right back. And we're back here with Dr. Sunil Gupta, and we just did the retina screen is what it's called. Is that correct?
Correct.
And it is Diabetes Awareness Month. That's part of the reason we're here. And so when I'm looking in there, I see a green dot, and it's in focus, it's out of focus, in focus, then it takes a picture of my retina. Now, once that happens, what do you do?
Sure. So I don't have to be at the point of service where this image was taken. So as a retina specialist, I could be at my office, I could be at my home, and what we do is we export this picture over the internet to the web, process it on our servers, and analyze it, and then spit the report back to your primary care doc saying you have disease or you don't. So 90% of the patients don't have damage.
Okay.
They can just come back in a year and have another photograph done.
And it was obviously very painless. It doesn't touch you at all. But spotting disease early, it's just like any other disease that you deal with. The earlier you catch it, the better you are of treating it, right?
Absolutely. So that's the critical issue. We have almost 300 million diabetics around the world, and at this point, only about 1/3 of those in the U.S. are being screened for diabetic eye disease. Now, imagine what's going on in the third world countries. So our goal is to utilize these technologies to make up the gap between the patients that aren't being screened, put these cameras in remote locations so that the patients can be evaluated. If we can get them early, we can prevent blindness from diabetes.
And we were showing what I think was a picture of a retina, and there were a bunch of colored dots. What was that?
So what you're seeing here, these little red dots are retinal hemorrhages, and basically we're taking a color photograph and basically analyzing it mathematically, using some algorithms, sort of picking my brain and doing it by computer, and then I do an overread on top of that. And so the great thing is over the last 20 years, we've figured out how to solve the problem of diabetic blindness.
Wow.
It's the #1 cause of blindness in working age people. And the key is to either get to your ophthalmologist or optometrist, get an annual evaluation, or the ones that we're missing, we want to get at least screened so we can fix them before they go blind.
And that is FDA approved, but there are maybe down the road some other uses for this as well.
Absolutely. So the current protocol that we've got approved is for diabetic retinopathy. The next 2 protocols are for macular degeneration and glaucoma, things that affect us as we get older. But lastly, we're working on collaboration with a group out of Canada where we should be able to give you a 5-year and 10-year predictive rate of heart attack or strokes.
Wow.
And maybe even your risk of Alzheimer's disease based on this same screening.
Just by taking a picture of your retina?
Absolutely.
Unbelievable. So again, that's not FDA approved yet, but somewhere down the road, that's maybe where we're headed. Well, fascinating stuff. We appreciate you bringing that in. Did I check out okay, by the way?
You did.
Okay, so I'm okay?
You're good.
Good stuff. I was a little worried to see, we're a little worried to see the printout.
If you're diabetic, or if your family members are diabetics, make sure they're getting their eyes checked.
Absolutely. We've got some numbers for you as well, and a website. You want to go to retinaspecialty.com. You have offices a lot of places, but here's some numbers for Mobile, Pensacola, and Biloxi. Again, retinaspecialty.com. Doctor, thank you very much. Appreciate
your time.
All right, stay with us. We'll be right back.